warm welcome to everyone. I am Sakshi Lakshman Surve and with me Snehadeep Kadam. On the behalf of Ashok Rao Mane Institute of Pharmaceutical Sciences and Research SAVE, we are presenting a seminar which is under the guidance of Mr. A.N. Degesu. This topic is truly based on previous year questions which carries weightage of 5 to 10 marks. So the question will be asked like this. Explain the steps involved in or process of complaint handling, or it can be asked like describe the complaint handling. So moving towards our topic, complaint handling. In this seminar, we will cover introduction of complaint handling, objectives, responsibilities, need of complaint handling, types of complaint handling, key for handling of complaint, content of product complaint datasheet, then steps involved in complaint handling of complaints, recordings of complaint and complaint evaluation. With this, firstly, the introduction of our topic. What is complaint? Complaint is something wrong or not good enough. But in pharmaceutical industries, complaints are regarding to the quality of the drug product. A complaint shows customers' dissatisfaction about the product and consequently about the company. With this, the principle behind this topic is all complaints and other information concerning potentially defective product should be carefully received and according to a written procedure, and correcting action should be taken. So moving forward, the objectives and responsibilities are. The objective is immediately recalling, investigate or take a remedial measure against an defective product. Then responsibility is the quality manager along with the manager of complaint related to the department. So what is the need for complaint handling system? So these are it gives opportunity to improve quality of product. It helpful to maintain the CGMP, current good manufacturing procedures. It maintains committed relationship between customer and company, then regulatory obligations. With this, moving forward to the types of a complaint. Mainly 3 types of complaints are there. Quality complaint, adverse reaction complaint and other medical related complaint. In quality complaint, it is originated at consumer level and concerns with physical, chemical and biological property. It comes under the conditions of labeling or packaging of the product. Then the second type is adverse reaction complaint. It is due to allergic reactions of any other untoward reaction or fatal or near fatal reaction. Other medical related complaints, it includes lack of efficacy or clinical responses. Further, time period for investigation after the receipt of complaint. There are mainly 3 days like time period, or 10 days or 5 days. In 3 days we can handle the medical complaints. In 10 days product quality complaints are handled, and in 5 days adverse reaction complaints are handled. Further, the types of complaint on the basis of patient condition. It is mainly of 3 types such as critical, major and minor. Critical, it can be life-threatening and requires a company to take immediate actions. Example, microbial contamination of sterile product. The product with incorrect name or incorrect strength. It comes under the critical conditions. Then in major, it may put the patient at some risk but are not life-threatening and will require a batch recall or a product withdrawal within a few days. For example, microbial combination of non-sterile product. A lack of information such as a labeling or leaflet. Then third is a minor. The minor risk patient batch recall or product withdrawal would normally be initiated within a few days. Example, visible isolated packaging or closure fault contamination which may cause a spoilage or a dirt and where there is a minimal risk to the patient. So, the key points for handling the complaints are: firstly, don't take it personally. Second, never act on complaint without hearing 2 sides too. Third, say what you will do and do what you say. Set the time frame. And fourth is keep notes. Further, content of product complaint data sheet. Firstly, it comes the serial number which assigned to the complaints. Second, exact nature of complaint. Third, name of the complaint. Fourth, address of that complaint. Fifth, date of the complaint received. Sixth, name of the product, strength and batch number of that product. Seventh, quantity involved in the complaint. Eighth, size of a sample obtained by quality control department. Ninth, name and signature of investigator and date. 10th, actions taken by the company. And 11th is copy of reply sent to the complaints. Moving forward, the steps involved in handling of a complaint. Here, separately 5 marks question should be asked. So, the steps are: firstly, receiving complaint, technical investigation, then corrective action and preventive action, that is CAPA, then feedback to the customer, and further monthly report and trained analysis. So, in detail explanation of the steps involved in handling of a complaint. Firstly, the receiving of complaint. It's important to have an open channel with customer in order to receive them suggestions, doubts and complaints. The channel are toll-free number, email, chat room and PO boxes. It is necessary to have a person in charge of receiving the complaints and inputting them into an appropriate investigation form that shall be addressed to Quality Assurance Unit for investigation. Then second is technical investigation. Upon the receipt of investigation form, the Quality Assurance Unit is able to start investigation. They are divided into 2 phases: documentation based and laboratory analysis. So the documentation based investigation, it consists of checking if this complaint occurred previously in the same lot or any non-conference was found in the lot during its production that could explain the complaint. The primary documentation to be reviewed in this step consists of complaint files and the batch record. Second, the laboratory based investigation. It consists of requesting the quality control laboratory to analyze both complaint samples, reverse sample representative a lot of a manufacturer. If the customer did not send the complaint sample for analysis, the laboratory investigation will be carried out only with retained samples. Similar to the receiving step, if it is fundamental that the company elects a person in QA unit to be in charge of technical investigation of each complaint, for example, a complaint officer. After receiving the analytical results, there are 3 possible conclusions. Firstly, confirmed complaint. Second, non-confirmed complaint. And third is a tamper suspicion or counterfeit. Third, a corrective action and a preventive action. Corrective action, that is eliminated detected non-conformity. It aims to correct an existing non-conformity and avoid a reoccurrence of same conformity. For example, arises from manufacturing deviations, OOS investigation, complaints audit findings, recall. Then the preventive action. It prevents the non-conformity occurrence. It aims to avoid the initial occurrence of the non-conformity by proactively implementing the improvement. For example, results from trending in process data, of analytical data, of audit findings, trending of root causes for non-conformities or complaints from product quality reviews, quality risk analysis. For all confirmed complaints, corrective actions must be implemented. These actions can range from a simple and quick training to some employees to follow corrective actions and preventive actions. CAPA handling. The criteria for choosing appropriate action depends on the nature of a complaint and the complaint incidence. If a CAPA is open, A multidisciplinary team consisting of a representative of QA and QC, regulatory affairs, and production management must be established concerning non-confirmed complaints originating from the misuse or inadequate handling of the drug product. Even if there is no need of internal corrective actions, corrective measures should be implemented to provide an orientation to the customer regarding counterfeit or tempered suspicious complaints. A response letter should also be sent to the customer, but the legal affairs until must be copied for further rearrangements or arrangements. Fourth, feedback to the customers. As the feedback to the customers, the company must write a response letter to the complaint to explain the investigation approach taken, the results obtained, and any implications in case of a quality problems was confirmed. The customer should be sent a free replacement product together with the response letter, since the customer returned to the product to the company for analysis. Fifth is monthly reports and trend analysis. Monthly reports should be elaborated in order to evaluate the amount and nature of a complaints received and to perform a trend analysis of these complaints. The recording of complaints. It's the responsibility of the in-charge quality control to see that each complaint is recorded, evaluated, and reported to the management. Complaints that contained complaints. This should include the name, dosage form, package form, batch number, date, and the place of occurrence of a complaint, cause of a complaint, name and address of the complaint in detail. Secondly, it includes results of investigation. It includes regarding marketplace, circulation condition, and condition in which the defect was observed, results of investigation of analysis and testing records, production and storage records. Third, evaluation, and fourth, follow-up measures. It includes reply to the complainant. Secondly, remedial actions so that complaint of this type should not reoccurs. So lastly, the complaint evaluation. First, complaint handling, receiving and recording. Establish a clear channels for customer to ensure complaints and ensure these are recorded accurately and efficiently according to IGNTU Amarkantak. Categorization and investigation, classifying the complaints by type, for example product quality, service and delivery. Also, the design, assign responsibilities for investigation to designated QA professionals according to IGNTU Amarkantak. Second, investigation and root cause analysis. Gathering the information, collect relevant data including customer feedback, product details and any supporting documentation as described on LinkedIn. The root cause identification is done by analyzing the complaint to pinpoint the underlying reasons for the issue as described on link. Utilizing tools. Employ tools like 5 whys method or fishbone diagrams to delve deeper into the root cause as described on the link. Then further moving on, corrective actions and preventive actions, that is the CAPA. Developing solutions based on root cause analysis, develops and implement a corrective actions to address the immediate issue and prevent recurrence. Preventive measures. The implement preventive measures such as a process improvements or additional training to minimize the likelihood or similar complaints in future as discussed in a PPT or a slideshows. Moving forward, the feedback and follow-up. Communicating with customers to provide timely feedback to the customers about the investigation and corrective actions taken as discussed above. Follow up, monitor the effectiveness of corrective actions and follow up with customers to ensure their satisfaction. Then the data management and reporting. Record keeping, maintain detailed records of all complaints, investigations and corrective actions for auditing and training the purposes. As discussed previously, The trend analysis regularly analyze complaint data to identify recurring issues and areas for improvement as discussed previously. By implementing a robust complaint evaluation process, organizations can not only improve the customer satisfaction but also enhance the product and a service quality, ultimately contributing to the long term success. So, thank you.